Allie. I'll be your therapist today.
Nice to meet you.
Is that position okay for your hip? You're comfortable? Great. So you are coming in with hip pain and decreased mobility.
Yeah.
You did have surgery 3 months ago. How's that going for you?
Pretty good so far.
Okay. So we'll just go through your health history to make sure we got everything covered. So under your respiratory conditions, you don't have a chronic cough, shortness of breath,
No.
bronchitis, asthma, no, emphysema, or a sinus infection, no. Under cardiovascular, you did check off high blood pressure.
Yeah.
I do see you're taking some medication, Sectrol.
Yeah.
Do you know what your last reading was?
I don't know what it was, but
Okay.
it has been regular.
Does it fluctuate a lot, or is it still?
It's pretty stable.
Okay, great. Have you ever had a heart attack?
No.
Varicose veins?
Nope.
Phlebitis?
Nope.
Ever had a stroke?
No.
Do you have a pacemaker or similar device? And you don't have poor circulation?
No.
Okay. Have you ever had any infections like hepatitis, tuberculosis, HIV, or any other condition?
Not that I know of.
Okay. Under skin conditions, you did check off warts.
Yeah.
It's on your foot.
Yeah, I got a couple on my feet.
Okay. Anywhere else?
No, just my feet.
Okay. Any rashes or athlete's foot?
No.
Nothing? Okay. Under other conditions, you did check out arthritis. What kind of arthritis is that?
It was the osteoarthritis that I had in my hip before my surgery.
Okay, great. So you don't have any loss of sensation, no diabetes,
No, I'm good.
any allergies that you know about?
Not that I know of, no.
Epilepsy, your cancer,
No.
fibromyalgia, any urinary or kidney disorders?
No.
Any digestive problems?
No.
Any liver issues? And have you ever had a hernia?
No.
Okay. So you do have hearing loss. You wear a hearing aid,
Yeah, I have hearing aids.
Okay. But no vision problems or vision loss?
No, they're good.
Okay. So for your soft tissue and joint discomfort, you do have low back pain.
A little bit, yeah.
And both your legs are sore.
Yeah, it's primarily my right side.
Your right hip, though. Could you point to where that pain is?
Just all around this here.
Okay. Back. Okay. So are you on any other medications other than Advil, Sectrol, or Prozac?
No.
You have had a previous fracture to your radius while you were a kid?
Yeah.
Is there anything other that I should know about?
Not that I can think of off the top of my head.
Okay. So you are going to another healthcare practitioner for rehab?
Yeah.
Anything else?
No, just the rehab right now.
Okay. Well, so I just have a few more questions for you.
Okay.
So how has the surgery affected your activities of daily living?
Well, normally I go golfing, so I can't do that anymore, which is
Okay.
upsetting. Gardening, I can't bend down to do that. And I normally go for walks with my wife, which have become very difficult, as well as going up and down stairs and getting into cars.
Okay. So what kind of hobbies or job tasks do you do?
Golfing is my primary, and walking's about what I go for, yeah.
Okay. So I see you are going to a physio clinic.
Yep.
What kind of rehab are you doing?
They have me in an aquatic program, which just helps build up some of the resistance and strength back in my hip.
Okay, great. So we covered your medications. How is your lifestyle? Any habits or exercise that you do on a daily basis?
That like aggravated, or how do you mean? Sorry.
Like, what do you do during the day?
Oh. Well, I'm retired, so I spend a lot of time with my wife. Tidy up the house. I'll occasionally go out and meet friends, so
Okay.
trying to get in the car to drive is a struggle still.
Do you know what position you sleep in?
I try to sleep on my back just to avoid sleeping on my right side because it seems to be the most comfortable position for me.
Okay. Has your physio or surgeon recommended massage therapy?
Yeah, they have.
Have you been to a massage therapy clinic before?
Once or twice before, yeah.
Was it a good experience for you?
Yeah, it was.
Okay, so I'll just ask you a few pain questions.
Okay.
So could you describe or point to the location of your pain?
It's mostly just in my whole right hip, but my other side of my leg hurts as well.
Okay. Could you describe the type of pain that you're feeling?
it's an achy feeling to it.
Okay. Out of 1 to 10, or 0 to 10, sorry, 10 being the worst possible pain, going to the hospital, what would you rate your pain right now?
Right now, probably about a 6.
Does it stay in that range?
If I do any type of activity like a walk or the aquafit, it'll increase it to about a 7 or 8.
Okay. How long does that pain usually last?
It's about an hour or two when I'm exercising post-exercise, and then it sometimes varies upon that too.
Okay. How often during your day does the pain happen?
Every time I exercise, so about 1 or 2 times a day, sometimes 3.
Okay. Does anything make it really worse for you?
Stairs, getting in and out of the car, and the long walks that I'll go for.
Okay. What makes your pain decrease?
Usually resting it and sometimes a bit of ice.
Okay. So you're taking Advil for it?
Yeah.
Are you taking anything else?
No, I was before, but they've got me off of it now.
Okay. Does the pain kind of refer or radiate to anywhere else?
No, it's pretty much in my hip for the most part.
Okay. Anything else you would like to tell me about your pain?
No.
Okay, Bill. So part of our observations today, I'll just watch you walk to the end of the hall and then come back.
Okay.
And then once you do that, I'll get a better idea of what's going on. Okay. You can go ahead.
How far do you want me to go?
You can turn around there. Okay, that's great. You can stop. So now that we did your gait, I'll analyze your posture. So just stand how you would normally at a grocery store, and I'll only be a few minutes, okay? Okay. So I'm looking for any internal or supination or pronation at the ankles. I'll check, are your feet ticklish? A little bit, but it's okay. So I'll just place my fingers underneath your arches. I think your arches are pretty normal. They are a little on the low side, but nothing too concerning. Okay, I'll just touch your calves. You do have increased muscle bulk on your left side. ASIS. They're in line, which is good. Your right shoulder is slightly elevated, mostly probably because you're cane. Okay, Bill, so I'll just look at you from the side. So I'm checking your alignment of some bone networks. Seems pretty in line, that's good. I see you do have a slight pelvic tilt. Anterior pelvic tilt. You do have slight hyperkyphosis and a small anterior head carriage. Yes. Okay, so during Bill's gait, I noticed a Trendelenburg pattern. He was favoring the left side, and he had his right hip popped out, meaning his glute med on his right side was weak. This is probably due because of the hip surgery. I also noticed an antalgic gait because he was limping due to pain. He did use his walker or cane to help him during his gait.
Hi Bill, my name is Allie. I'm going to be doing the assessment portion of your treatment today. Before we get started, I want to just explain to you what the assessment entails. So the purpose of the assessment is to try to narrow down which structures are involved and what is likely the cause of your pain. So I do want you to know that we're aiming to recreate your symptoms and your pain in order to try and determine what's causing it. So if you're uncomfortable at any time, feel free to stop me. If we don't continue with the assessment, the likelihood of me discovering what's going on is quite low. You can stop any of the tests at any time if they're causing you discomfort, but again, we won't find out what's going on with your hip or whether it is your hip that's causing your low back pain as well as the pain in your other leg. If I find something that's outside of my scope of practice, I will refer you to another healthcare professional or to Emerge if need be. Do you have any questions for me at this time?
No.
Okay, do I have your consent to perform this assessment?
Yes.
Great. Okay, so the first part of the assessment is going to be range of motion. So I'm going to take a peek at your lumbar spine and your knee, just to rule out that those two things aren't causing your hip pain. So what I'm going to have you do is actually put your hands on the table here, and I'm going to have you bend forward through your back. So try not to involve your hips if you can help it, but you're going to try and round your back as far as you can go. Any problems with that?
No.
I'm just going to add a little bit of overpressure. Are you okay there?
Yep.
Good. Okay. What I'm going to do next is actually have you bend one knee. So I'm going to get you to hold on for support as well. And I'm going to have you bend your right knee up as far as you can. Any issues with that?
Nope.
Okay, I'm just going to add overpressure there. You okay?
Yep.
Good. What I'm going to have you do now is actually lie on your stomach.
Okay.
You okay?
Yep.
Okay, what I'm going to do now is actually just see how your lumbar spine is moving. So I'm going to do posterior to anterior glides of the lumbar spine. So Bill, if you feel uncomfortable, just stop me at any time, okay?
Okay.
You okay there?
Yep.
So I'm just seeing that all the spinous processes are moving in an anterior direction, which tells us about the extension of the lumbar spine. Good, still comfortable?
Yep.
Could I get you to sit up on the edge of the table here? And just have your legs over the side. I'm just going to see how your knee is doing in extension. So if you could straighten your knee as much as possible. Any issues there? I'm just going to add overpressure. No problems?
No.
Good. And I'm just going to do the rotations of both the knee and the lumbar spine just to make sure those joints are moving okay. So if you can you turn your toes sort of inward there? Good. And I'm just going to add overpressure. Anything there?
No.
Good. And then the other way. Any issues with that?
No.
Good. And I'm going to have you cross your arms over your chest, and I'm going to have you rotate as far as you can one way. Any issue there?
No.
I'm just going to add a tiny bit of overpressure. And same thing the other direction. Any issue there?
No.
Still okay?
Yes.
Good. So now we can move on to the range of motion of your hip. Okay. So we're going to be doing the active resisted range of motion of your left hip, the unaffected hip. So first I'm going to do active, passive, and resisted. So we'll start with active. So what I want you to do, Bill, is actually try and keep your legs straight, and I'm going to have you raise it up off the table. Good. Any issues with that?
No.
Okay, I'm just going to do that passively for you, so try and relax. Any issue there?
No.
Okay, and now I'm going to do resisted, so try your best. I'm going to actually have you hold your leg here and try not to let me move you. So build for 5, 5, 4, 3, 2, 1, and hold for 5, 4, 3, 2, 1. Good. Next I'm going to try the rotations. So we're going to bend your knee there. Are you comfortable?
Yes.
Good. I'm going to have you try and bring your foot in towards center. Good. Any issues with that?
No.
Good. I'm just going to do that movement passively for you. Still okay there?
Yep.
Good. And I'm going to do the resisted of external rotation as well. So don't let me move you. I'm just going to bring you to mid-range, and don't let me move you there. So build for 5, 4, 3, 2, 1, and hold for 5, 4, 3, 2. Okay, so now we're going to do the same thing going the other direction. So we'll get you up here, and I'm going to have you let your leg fall out to the side as far as possible. Is that comfortable?
Yep.
Okay, I'm just going to do that passively now. Any issues there?
No.
Good. And I'm going to have you do the resisted range of motion as well. So I'm going to bring you out a little bit, and I don't want you to let me move you, okay?
Okay.
So build for 5, 4, 3, 2, 1, and hold 5, 4, 3, 2, 1. Good. And we're going to come around to your affected side. And we're going to do active, passive, and resisted range of motion for hip extension. So what I'm going to have you do, Bill, is try to keep your legs straight, and I want you to try and raise it off the table without getting your low back involved. Okay. So go ahead. Good. Any issues or discomfort with that one?
A bit of pain.
Okay.
Discomfort, actually.
Okay. A little uncomfortable?
Yeah.
I'm going to do that movement passively, so you let me know if it hurts, okay?
Okay.
Any issues there?
Nope.
Okay. And we'll do the resisted range of motion, so I'll just get you to meet my resistance. If you feel discomfort, feel free to stop, okay? So we'll bring you into mid-range here.
Okay.
I'm going to apply just gentle pressure here, so build for 5, 4, 3, 2, 1, and hold for 5.
A bit uncomfortable.
Okay? So that wouldn't be full strength there. I'm going to take a peek at your external rotation of the hip, so I'm going to have you actively move your foot in towards midline. Any issue with that one?
A bit of discomfort as well.
Okay, and I'm going to have you relax this time. And I'll do that movement. Are you okay there?
Yep.
Okay, good. And now we're going to also attempt the resisted, so you might feel a little bit of discomfort with this. I don't want you to let me move you here. So build for 5, 4, 3, 2, 1, and hold for 5, 4, 3.
It's a bit too uncomfortable.
Okay. So last but not least, we'll do the medial rotation. So I'll have you move your foot out to the side here actively. Good. Any issues with that one?
Nope.
Okay. I'm going to do that one passively here for you. Any issue there?
No.
Good. And then we'll also do the resisted. So same thing, don't let me move you. Build for 5, 4, 3, 2, 1, and hold for 5, 4, 3, 2, 1. Good. Okay. So now what we'll do is we're going to do the ranges of motion, which I think will be a little bit more uncomfortable for you, Bill, which requires you to turn over. So, okay, Bill, so the last ranges of motion we have left are active resisted flexion and abduction of the affected side. So I'm going to bring you first into mid-range here. You okay there?
Yeah.
And I'm going to apply some pressure downward, so I don't want you to let me move you. We're going to build for 5, 4,
that's uncomfortable.
uncomfortable, okay. And same thing with abduction. You okay there?
Yeah.
Okay, and don't let me move you here. Build for 5.
That's
Uncomfortable too? Okay, no problem. What I'd like to do just before we get you off the table to discuss your treatment, I want to measure some active ranges of motion of those two movements that bothered you. Okay, so I'm just going to locate your trochanter. And what I want to have you do, Bill, is try and raise your straight leg off the table there again. Good. So you have 50 degrees of hip flexion. And I'm going to have you bring your straight leg out as far as you can from the midline as well. Okay, go ahead. And you have 20 degrees of hip abduction. Okay? Thank you.
No problem.
So during the range of motion assessment, I found that Bill's range of motion on his unaffected side was within normal limits. His strength was 5 out of 5 for his left hip. When we got to the affected side, I found that all of his ranges of motion were limited, and both flexion, abduction, external rotation, and hip extension were all weak, 3 out of 5. He was able to maintain the contraction against gravity, but he was not able to maintain contraction against resistance. So we will perform a few special tests here to try and determine where his pain is coming from. Okay, Bill, we're going to put you through a couple of special tests to try and establish what structures are involved with your discomfort. The first test I want to do is the Trendelenburg sign. So what I'm going to have you do is hold on to the table, and I'm going to have you stand on your right leg. Do you feel comfortable doing that? Mm-hmm. Good. And I'm just going to watch your hips here and see what happens. Good, so you can go ahead and stop there. So I did notice with that test that your hip does come out to the side a little bit, which indicates a glute med weakness on your stance leg. So that's also something we saw during your gait. When you sort of took a step, that was happening a little bit, so hopefully we can address that. The next test I want to do, I'm going to actually have you lying on your back. This tests for deep vein thrombosis, so I'm just going to grab a hold of your muscle bulk here, and you let me know if you feel any discomfort at all. I'm just going to give it a squeeze. Are you okay there?
Yep.
Good. So that test would be negative for deep vein thrombosis, which is excellent. The next test we're going to do is a passive straight leg raise. So this tests for any sciatic nerve impingement problems, also radiculopathy in the lumbar spine. It can also tell us a little bit about your hamstring length. So you just let me know at any time if you feel discomfort. I know you're limited in this range of motion, so I just want you to let me know what you're feeling. How are you doing?
Good, just a little bit of pulling
Pulling?
on the back of my leg.
Back of your leg, okay. And I'll put you back down here. So since Bill's just feeling pulling, that indicates a short and tight hamstring. So that's a negative test result for anything neurological, but still worth noting in terms of his muscle length. Okay, so we're just going to do an observation of your gait while you're climbing stairs as well as when you're descending stairs. So I want you to do it how you would normally do it at home. I'm just going to ask you to go up the first 4 steps and then take your time turning around, and then you can come down the last 4 steps, okay? We're just going to take a peek at how you do that. Okay, great. So I noticed with your gait that you are doing a lot of weight shifting off of your right side, which is completely normal post-surgery. So what we'll try and do is normalize that walking pattern and see how we do. Same thing on the way down, spending the least amount of time on your right side compared to your left. So we'll try and work on normalizing that walking pattern.
Hi Bill, I'm Erin. I'll be your massage therapist for today. So I'm going to have you face down between the sheets. Your abdomen is going to be on this pillow and your shins are going to be on this pillow. Preferably if you would like your glutes worked on skin contact is best. But just undress to your comfort level. And I'm going to wash my hands and I'll be back. How are the pillows?
Good.
Good? And how's the hydro?
Good.
Do you feel secure?
Yes.
Perfect. So I'm just going to assess the fascia. So it's limited this way, laterally. Again, laterally. Here it's restricted medially and laterally. Medially and laterally as well. There. Doing some myofascial work just to release some of the adhesions. This technique is going to be direct myofascial, and you might feel some discomfort as I'm not using any lotion. I'm just going to glide to break up the fascia. Any pain? No? I'm starting to see some hyperemia here. Pressure still okay?
Yep.
Okay, so next I'm going to be doing some skin rolling. I'm just going to move the fascia in a wave-like motion. Is the pressure okay?
Yep.
These myofascial techniques are going to help to break up the fascia and reduce scar tissue. So next I'm just going to affinage. This flushes out the area and any inflammation. And then I'll start with my broad contact kneading. This is going to help to reduce the hypertonicity in Bill's hamstrings and his glutes. I'm just doing all this gently because he's post-surgery as well. And how are you doing, Bill?
Good.
So next I'm going to be doing wing. Okay, Bill, so we're just going to start with some passive range of motion again. I'm going to get you to hold on to this sheet so that you're secure, and I'm going to lift your leg up and do some flexion. Any pain with that? Perfect. I'm just going to do that 5 times or so. I would do it more if we had more time. And then I'm passively going to take you into some abduction, and any pain with that? And adduction, any pain? Stop me if there's any pain. on to the massage. So I'm going to start with Efforage. Just spread the lotion and get some circulation. I'm going to go into some broad contact kneading. Pressure okay?
Yep.
Perfect. Now that the tissue's warmed up, I'm going to do a flat palpation until I feel a taut band. And I feel one right here in your rectus femoris. Does this cause you any discomfort?
There's tenderness there.
Okay. And I'm just waiting for a twitch response as I hold my ischemic compression. And I feel a twitch now. So I'm just going to hold it and let me know if the pain gets over a 6 or a 7. Okay? And it hopefully will dissipate. And just let me know when it goes down.
It's lower now.
It's lower? Perfect. So I'm just going to heat the area with Efforage. And then I'm going to manually stretch it. And I'm going to use this to take some of the lotion off. And I'm going to do some muscle stripping as well. And any pain? Perfect. And I'm going to finish off with some more petrissage, some sea scooping.
The end of our treatment today, just take your time getting off the table.
So for some of the home care that we want to give you today to help with your issues in your hips was we noticed when you are standing as well as walking, you have the Trendelenburg sign. So when you're sitting, we're going to get you to focus on sitting equally on both of your hips as much as you can. And during your walk, we want you to focus with your affected side more so because you notice when you're planting it's flat to try and go through the complete heel strike to toe off. Okay. So with that, you want to have maybe some shorter steps as well as making them equal on both sides. So when you walked, you lifted your affected side quicker. We want you to have stance on both of your feet equally when you're walking.
Okay.
And due to the fascial adhesions and some of the hypertonicity in your legs, for some home care after a hot shower, or even just some hydro, so put a warm cloth on it for about 15 minutes or so, and then in that area we want you to get you to do some fascial work. So just with your palm, go along the surface of your skin with about 10% to 15% of your force, and you're just trying to break up some of those adhesions.
Okay.
As well as if it's starting to feel tight, just do some general what's called sea scooping. So just make a C with your hand,
Okay.
and drag along that, and you're trying to get the muscle. Or you could even do some shaking. So if you just grab onto the muscle and shake it around a little bit, that'll help to loosen them up.
Like this?
Yep, that's perfect.
Okay.
As well as to keep your range of motion, because that seems to be a big thing for you, we're going to take you through some active range of motion. So if you want to stand up with me. So what I'm going to get you to do is your hips do multiple actions that we want to maintain. So if you want to lift your hip just to where it's comfortable and you don't want to reach a level of pain at all, and then if you bring it back behind you, just watch the chair. Good. And then bring it out to the side where it's comfortable. Any pain with those? No. And bring it across in front of your body. Okay. And then you're going to turn it out just slowly. Keep your hips facing forward. You don't want them to move, you just want to turn your leg. And then turn it to the inside. And any pain?
Nope.
Perfect. So that's what we want you to do over the next couple weeks that we're seeing with treatment, and hopefully that will keep maintaining the work that we're doing on you.
Okay.
Great. So for our treatment plan, what we're looking to do is get you in over the course of the next month, and we want you to come in each week for about an hour. So it's going to be about $80 an hour, so over the next month it's going to come to $320. Is there any financial concern for you? No? No? Okay. So what we're looking to do is maintain the range of motion that you have in your hip, as well as decrease some of the scar tissue. Do all those goals sound relatively on track with what you want them?
Yes.
Okay. We're also looking to decrease some of the fascial adhesions as well, which will help to maintain some of that range of motion and decrease some of the pain due to the trigger points you have. So that'll help with your everyday living, or the walks that you go on in golfing, as well as stairs and getting in and out of the car. Do you have any concerns with the treatment plan that we have for you? Nope. I have your consent to continue forward with it then?
Yes.
Perfect.